Robotic surgery is a technique that helps the surgeon, and the surgeon is sitting at a console and remotely controls small instruments through tiny incisions that are attached to a robot. Robotic assisted surgery helps with the limitations of minimally invasive or laparoscopic surgery, as well as enhances the dexterity of the surgeon's capabilities themselves. Just about any surgery can be done with robotic surgery, and as the technology improves, that's going to get even better. The biggest advantage in robotic surgery is actually operating in the pelvis. So if you have pelvic floor reconstruction or if you have rectal cancer, that gives the best advantage to the patient for more precise surgery and more precise excision, particularly of a tumor. Well, the great thing about this technology is it's state-of-the-art technology through very, very tiny incisions. So there's minimal scarring and there's minimal incisions involved. That's one thing that's great. The other is that it has excellent 3D high-definition vision, so there's more precise removal of the tumor. You can actually see the nerves that allow for bowel function, bladder function, and sexual function, so you avoid damaging those. In addition, because it's so minimally invasive, there's a quicker recovery for your diet, there's a quicker recovery of bowel function, there's a shorter hospitalization, a quicker recovery back to work. The robot is not performing the procedure. The robot is an extension of the surgeon. So the surgeon is controlling the arms or the tools that the robot is using remotely. So there's nothing that's done without every thought process of the surgeon. And it's extremely safe, and there's a lot of safety measures built into the system. So in other words, I'm actually putting my head into the console, and there's radio frequency waves that are bouncing off my head, and if I pull my head out where I'm not looking anymore, everything automatically stops until I reintroduce myself and my hand movements back. So it's extremely safe technique. The biggest advance is operating in the pelvis, because with laparoscopic surgery, your moves are really limited to this. With robotic surgery, your moves are actually have a significant rotation and twisting of the wrist, so you can get deep and further down in the pelvis with very complicated rectal cancers. So by doing that, you can avoid nerve damage, you can avoid a permanent colostomy, you have a much more likelihood of removing the entire tumor and joining the bowel back together again through all of this remote technology. And the other great advantage of these are really small instruments and small tools that you're using, so the recovery is significantly quicker than the laparoscopic or the traditional approach.